Good morning, good afternoon. Thank you so much, CAB members, for joining our community data discussion and for providing feedback on this presentation today. The presentation will take about 10 minutes, and then we will ask you to complete kind of a feedback survey to ask you your thoughts on this presentation. So thanks so much for your help. So my name is Jamie Frederick, and my colleague here, Amanda Tyler, is with me to talk about a project that we conducted in 2023 to better understand equity in SNAP Ed across the state of Georgia. So we look forward to speaking with you today. So thank you so much for joining. We are from the Public Health Institute Center for Wellness and Nutrition. And again, we'd like to share results about a racial equity project that we conducted in 2023. So the purpose of this discussion is to share what we heard from the community members and reflect on the findings together. So the session today will take about an hour, and your participation is voluntary and you can stop at any time. Your decision to participate will not affect any benefits that you receive from SNAP or SNAP Ed. And at the end of the session, we'll talk about how you can receive reimbursement for expenses related to your participation today. So we want to make sure that this is a safe space for everyone to feel comfortable and ready to share today. So here are a few group agreements on the screen. So speak from our own experience, seek understanding, be open, vulnerable, and a little uncomfortable, engage in dialogue, not debate, and be conscious of language and tone. Does anyone have any agreements to add? And please give me a thumbs up if you agree with the agreements today. So again, welcome. If you can, please share your name and favorite healthy food in the chat so we can all get to know each other a little bit better. And then just to provide a little bit of background on SNAP Ed in Georgia, the state of Georgia contracts with 5 implementing agencies to provide nutrition education and create healthier environments where Georgians live, work, learn, shop, and play. These implementing agencies are Health Empowers, Open Hand Atlanta, Georgia Department of Public Health, and University of Georgia, and Hand, Heart, Soul Project. And then the map here shows locations of SNAP Ed programs throughout the state. So the Supplemental Nutrition Assistance Program, or SNAP, also called EBT, FNS, or food stamps, provides benefits to individuals to help pay for the cost of food. And SNAP Ed, or SNAP Education, is the nutrition education part of SNAP. Some examples of SNAP Ed include Cooking Matters, Food Talk, Farm to Fork, and nutrition lessons. And SNAP Ed works to implement strategies or interventions that help establish healthy eating habits and maintain an active lifestyle. So now we will get to the results of our SNAP Ed project. We wanted to better understand racial equity across SNAP Ed. So who participated in the project? We conducted both feedback groups and interviews, as well as an online survey with participants in Georgia. So 13 people participated in feedback groups or interviews, and 148 people participated in an online survey. And participants for both activities were mostly between 18 and 54 years old, identified as female or women, and spoke English. The participants in the feedback groups were primarily Black or African American, and the online survey had representation from Black and white participants. So first, we looked at participation in SNAP. So who participates? We found that about 7 in 10 people reported ever participating or ever using SNAP benefits, or EBT. And participation rates were similar across all races and ethnicities as well. We also looked at participation in SNAP Ed among the online survey respondents, and we found that 3 in 10 people reported ever participating in SNAP Ed programs. And again, we wanted to better understand this by race, ethnicity, and participation rates were similar across race ethnicities. All right, so taking this again from the this slide of food security. So we looked at food security, which is defined as consistent access to enough food to live a healthy and active life. And we found that 2 in 10 or 20% of respondents reported that they experienced food security or had enough food to live a healthy and active lifestyle. That means that 8 in 10 people or 80% experienced food insecurity, meaning that they did not have enough food. So some people or some feedback group participants confirmed that they had difficulty accessing food. One person said that food prices are astronomically high, and there have been times that they cannot afford food. We also looked at food security by race ethnicity, and the rates are fairly similar across groups. By each race ethnicity group, we listed the number of people who responded to this question. So for example, the American Indian and Alaska Native group only had one person responding to this question. So some groups had small sample sizes, but here we can see that food insecurity is slightly higher among Black participants at 84% than white participants at 74%. And then we looked at nutrition security. Nutrition security is a little bit different than food security alone because it means you have to have consistent access to healthy foods to promote well-being. We did hear that people had more nutrition security than food security, which was a little surprising to hear. About 6 in 10 people reported that they had enough fresh fruits and vegetables, that fresh fruits and vegetables were affordable and also high quality. And 7 in 10 people reported that local foods met their cultural needs. We also looked at nutrition security across race ethnicity groups. We combined 4 questions and added the scores up to 4, 4 meaning the highest nutrition security and 0 as the lowest. The 4 questions were if participants had access to fresh fruits and vegetables, access to high quality fruits and vegetables, access to affordable fruits and vegetables, and then that foods were also culturally appropriate. Here again, we see that American Indian and Alaska Native had the highest nutrition security, but again, there was only one person in this group. It shows here that Black respondents had higher levels of nutrition security than white respondents. So we'll plan to discuss this a little bit later, and we're interested to know if the results here are reflective of your own experience. So now I will pass to Amanda for this next section. Thank you.
Thank you, Jamie. During the feedback groups, participants were asked if their SNAP Ed lessons were designed with their community in mind, and if they thought the race, ethnicity, and culture of their community is reflected in SNAP Ed classes. The majority of participants reported that SNAP Ed classes did equitably reflect their culture and community. As one participant stated that they felt like, or I feel like they were designed for all different cultures, ethnicities, whatever, because it's simple stuff that you can make. So anybody can do it, whether you're rich, poor, or whether you're receiving food. I think it's something that could really help. So I think that's definitely designed for all of us, and we can all benefit from it. It's also important to understand the community's literacy levels, as one participant did reflect on how there are many people who don't know how to read, and it can be more difficult for them to participate in classes. Some felt it would be easier to trust an instructor who looked like them and thought it would bring in more people who had not previously participated in SNAP Ed classes. One participant stated that having people that look like you teaching the classes, if I see someone who is from my community and looks like me that I know and I see throughout the community, church or school, I think it's a trust factor, and just representation matters. We did hear from participants that it is hard to hear or know about SNAP Ed programs. and that most people aren't aware of SNAP-Ed. One participant said, I think the SNAP-Ed program is a good concept, but I definitely think we just got to work on getting it to the people that really need it. Well, another participant stated that I think it's a marketing issue. If there's an event or a class, maybe it can be shared a variety of ways, like Facebook or at places people are going, like a farmer's market. They could have flyers there or have a representative from SNAP-Ed. When looking at community recommendations, we asked participants to imagine an ideal world and what their community would look like if people had enough of the food to eat and lots of places and spaces that encourage physical activity. One participant said, I think the food should be more affordable. While we always have food, it's just so expensive that eating healthy sometimes isn't possible. The healthier food is more expensive than the fatty, unhealthy food. While another participant said, if more communities acknowledge the need, there could be more pantries open to service the community so that the local government will provide food where it is needed most. When looking at some community recommendations to improve access to healthy food, participants recommended more farmers markets or farm stands, a better variety of produce at local stores, and higher quality produce at local stores. To improve access to SNAP-Ed, recommendations included more information about SNAP-Ed, classes offered at convenient times, and classes offered closer to home. Other recommendations from community members included marketing SNAP-Ed classes to reach a broader audience, hiring SNAP-Ed instructors with similar race ethnicity as participants, and cooking culturally relevant meals during classes. These are the reflection questions we will go over with the group, but for the purpose of this recording, we will stop the presentation here. Thank you for providing feedback.